Hey everybody, I'm Dr. Taryn Mason with Fostering Wellness and Randolph Chiropractic, and I get to bring you tonight's webinar, which is Focus, a workshop on ADHD. This is such a huge thing that we're dealing with. We have tons of young patients that suffer from ADHD. It's also something we're finding more and more adults diagnosed with. So it's something we really want to get to the bottom to, better understand, and kind of talk about some ways that maybe it can be treated naturally without medication. So let's get started. There we go. Oops, sorry. Okay, so if we're going to talk about it, let's first define it. What is ADHD? And real quick, I just want to cover this base right away. We frequently refer to ADHD and ADD as if they're synonymous. ADD is actually an old term that we're not really using anymore. It is either ADHD, which stands for Attention Deficit Hyperactivity Disorder, or also sometimes is referred to HKD, which is Hyperactivity Kinetic Disorder. We don't hear HKD as often, so ADHD. And then there are also different types of ADHD. There are 3 different forms, and we'll dive into that in a second here. But anyway, so the DSM-5, which is the Diagnostic and Statistical Manual of Mental Disorders, and that's the text that is the end-all be-all for kind of describing and that is used for diagnosing mental disorders. So the DSM-5, 5 just means it's the 5th edition. It defines ADHD as a persistent pattern of inattention and or hyperactivity impulsivity that interferes with functioning or development, has symptoms presenting in 2 or more settings, so home, school, work, friends, relatives, other activities, and negatively impacts directly on social, academic, or occupational functioning. Several symptoms must be present before the age of 12 years. So if this were going to be diagnosed in an adult, the symptoms have to have been present before they were 12 years old. And the symptoms also have to be present for 6 months or longer. So if a kid is just having some of these symptoms for the past couple of weeks, there's probably something else going on in their lives, and they are not truly suffering from ADHD. So we're going to talk about the components. There's 3 components: the inattention, the hyperactivity, and the impulsivity. And children will often tend to be more dominant in, say, inattention or in hyperactivity. And so that kind of determines the type of ADHD they are, or they're a combined type, which means they suffer with inattention as well as hyperactivity pretty much equally. So anyway, so let's just talk about the symptoms under each component. So there's inattention. So that means children often lose things necessary for daily activities. Ask my mother, this was me. Failure to pay close attention to detail, making careless mistakes. Difficulty in organizing tasks and activities. Often does not listen when spoken to directly. Also, avoidance of activities that demand sustained mental effort. Forgetfulness in daily activities, often distracted by extraneous stimuli. Difficulty sustaining attention during activities and easily distracted. And difficulty following instructions and failure to complete tasks. Next is hyperactivity. So the hyperactive child will often fidget with hands or feet or squirm in seat, often leave seat in classroom or other situations in which remaining seated is expected, and often talks excessively. Hyperactivity often has difficulty playing or engaging in leisure activities quietly. So if you tell a child to just play over there quietly, they can't keep the noise down. They're always kind of getting amped up. They often run about or climb excessively in situations in which it is inappropriate. In adolescents and adults, they're probably not going to be running and climbing on everything, but what they might just be feeling is feelings of restlessness. And then this child is often on the go or often acts as if they are driven by a motor. And you'll notice I am referring to child. Certainly you can have ADHD in an adult, but we're really focusing on the child component for this purpose of this webinar. But a lot of the kind of advice and tools I'm going to give you, certainly you could apply as an adult as well. So the impulsivity, that 3rd component. So they often will blurt out answers before questions have been completed. They often have difficulty waiting their turn and often interrupt or intrude on others. So there's the inattention, hyperactivity, and impulsivity. So you might have, again, a child who struggles more with the inattention or more with the hyperactivity, or there's the combined type that really both are an issue. And so again, they must have these symptoms. They have in multiple areas of their life. They have to be affecting those areas of their lives, and they must have them for more than 6 months or more, and also I believe it is they have to have more than 6 of those symptoms that we just listed there. So, analyzing the problem. Some people have real ADHD, but it's a very, very widely misdiagnosed disorder. So if your child's been diagnosed with ADHD, see, I'm using that old term, you may believe that he or she may have it. Make sure that the diagnosis comes from a reputable mental health professional that specializes in this, because again, it's very commonly misdiagnosed, and you don't want to, if you have the wrong diagnosis, you have the wrong treatment, and so you really don't want to put your child through that. And again, a kid that just struggles to pay attention in school, that's not technically or not truly ADHD. So you want to make sure that you are getting the right diagnosis, so take them to the right professional. And then talk to your child about the difficulties that he or she is having to get to the underlying cause of what's going on. So again, to really have a true diagnosis of this, they have to be suffering from these symptoms for greater than 6 months. So if your child is just like super hyperactive and fidgety and not paying attention and not focusing for like 3 weeks, maybe talk to your child and figure out what's going on in their lives that causes change in behavior. So some non-ADHD causes for the inability to focus might include dyslexia. So that's an issue where children oftentimes struggle to read because their brain is processing things backwards. So that might appear like ADHD. Also, the learning style of the student, if it does not match the teaching style of the classroom. So if the teacher is standing up and lecturing, but the child is more of a kinesthetic learner where they learn by using their hands, they're probably going to struggle to focus and struggle to learn in that situation. So that might show up with some ADHD type symptoms. Also, if a child is bored in school, kids like adults have trouble concentrating if things are too easy. Kids need to be challenged. And so if you think your kid's not being challenged in school, you can actually ask the school to provide an aptitude test. And if you find that your child really has an accelerated aptitude, then maybe they can find ways to challenge them more, put them into more advanced classes. And that could really be very beneficial. Also, the material could be too advanced. So if the material is so over a kid's head, and I've certainly sat in lectures like that before, I'm like, I have no idea what's going on, so I'm just going to zone out. So again, you can do an aptitude test and really find out if the child is where they're supposed to be. And then also emotional behavioral causes. So is there tension in the home life? Is your kid being bullied? Are there any stresses that are affecting his or her concentration? Have there been any big changes? Maybe a move or a divorce or a death of a loved one? And then just some other kind of extraneous things. Thyroid issues could cause some ADHD type symptoms. Also lead poisoning, sleep issues, anxiety, depression. So you really want to check and make sure that you get to the bottom of what's going on and get the right diagnosis, because you certainly don't want your child to have the wrong treatment. Diagnosing ADHD incorrectly can be detrimental to a child's emotional and physical well-being, especially when the solution is medication. Fortunately, there are natural remedies that help alleviate the symptoms of ADHD, so they don't have the negative side effects. So if you just think that your kid might have this and they don't really have the diagnosis, maybe you can apply some of these natural remedies that I'm going to talk about a little bit later, because they're not going to have negative side effects. Whereas if a child were to get on a medication, there certainly are side effects to any drug. We're actually going to talk about those right now. There's several medications on the market that help control the symptoms of ADHD. They do their best to mask the symptoms of ADHD, but as soon as the medication ceases, is out of your kid's symptom, the symptoms return. And this is just staggering to me. Both of the ADHD drugs are the most common psychotropic drugs used by children. And psychotropic means that it affects their brain. It changes the way that their brain functions. It's also tied for first with antidepressants. So our kids are on these ADHD drugs. So we're talking Ritalin, Vyvanse, Concerta, Adderall, just some of the more generic names that you've probably heard. But it's tied with antidepressants. We got to get to the bottom of what's going on with our kids, guys, because certainly we don't want our kids on either of those drugs, I don't think. Just some of the side effects that come with these medications: nausea, stomach pain, vomiting, headaches, insomnia, loss of appetite, dizziness, irritability and mood swings, increased anxiety, fatigue, increased blood pressure, increased heart rate, hallucinations, severe rash and blistering, shortness of breath, seizure, numbness in extremities. Whoa. Lots and lots of side effects that go on with these medications. And again, I'm not saying that these medications don't help some people and they don't help some children, but certainly if we can deal with this more naturally, if we can even prevent ADHD, and I'm going to touch on that briefly as well, we can avoid these drugs. And I think that's what any parent wants, because certainly you don't want your child to have these side effects. And just the most common, like show up all the time in all of the studies done on these drugs and their side effects, is loss of appetite and loss of sleep. And also, loss of sleep, lack of sleep, can cause some of the ADHD type symptoms. Irritable, hyperactive. You know how kids get crazy when they're overtired? Yeah, so certainly it doesn't help when the side effects can actually make the symptoms worse. But I'm not saying that they don't help. Some kids, they certainly do, but it's ideal if we can avoid these nasty side effects. Also, just where was it? I read something in my research for this, and I know I cited the resource at the end, something like 23,000 ER visits in like 2011 due to these medications. 23,000 ER visits. So again, if we can avoid these, then that's what we should do. So some withdrawal symptoms, I just wanted to point this out as well, because we actually don't know a lot of the long-term effects that these drugs have, because they haven't been around for a whole heck of a long time. But when we try to get off of these medications, and when the kids get off these medications, just because they decide they don't want to be on medication for the rest of their life, or maybe they've addressed some other causes of the ADHD and they think they can manage without the medication. Withdrawals, irritability, fatigue, depression, headache, unusual behavior, which is seen more with Ritalin and Concerta, which are the methylphenidate-based medications. And you can see changes in heart rhythm with Adderall, which is the amphetamine-based medication. And another thing with the Adderall, the amphetamine-based medication, is sometimes they can feel, they feel like not right without it. They don't feel right without a medication, which is kind of a dependent behavior, which again, we don't want to be giving our young children medications that they're going to become dependent on, right? So just some of the nasty withdrawal symptoms. All right, so I told you we would talk about even some ways that we can hopefully prevent ADHD. Because again, prevention is the best medicine, right? If we can cut something off of the head before it even starts, that's the best way to go. So we could prevent that and then not have to even talk about those medications for your kids. That's the best thing, right? So one of the best things we can do is have a healthy pregnancy. So stay healthy during your pregnancy. You can help your child avoid developing ADHD. Studies have found that women who smoke tobacco or consume alcohol during their pregnancy have a greater chance of having children with ADHD. Ladies, we know that it's not okay to smoke and drink when you're pregnant. Certainly, though, if that's an addiction you're dealing with when you get pregnant, particularly tobacco, it's a really hard thing to give up. I highly suggest, whether you're a smoker or a drinker or anything, before you decide to become pregnant, get yourself healthy. I mean, you should get yourself healthy anyway, but it is, we found in epigenetics, we used to think that genes, okay, we thought that genes were what make people sick, but we now know that it's not genes that make people sick, it's the way we express them, right? And so, doesn't matter, I'm like totally going down a rabbit hole, but you can help your child have better expression of their DNA, better gene expression, by you making healthier decisions. So I don't have kids yet. I don't have planned to have children anytime in the near future. Sorry, Mom. But I choose to make healthy decisions now. I mean, A, because it's part of my lifestyle. That's part of what I do, and I'm preaching to people all the time. But one of the biggest things that motivates me is someday I'm going to have children, and I want them to be so healthy. I want them to have the best lives possible, and so I make good decisions now. So if you get yourself healthy now, you're going to have a healthier child, and so again, you're going to have a child that's less likely to suffer from ADHD, along with thousands of other disorders. So eating a natural and healthy diet while pregnant will help ensure that your children will have the nutrients they need to develop a healthy mind and body. So we talk about this all the time. We talk about nutrition in our office and pretty much all of our other webinars, because the things that are good for you are always good for you, for the most part. So we talk about healthy fats, quality proteins, and colorful vegetables and some fruits, right? So you want to be doing that, particularly when you're pregnant. And then also try to stay relaxed during your pregnancy and get plenty of sleep. if your pregnancy is just riddled with anxiety and stress, you're producing those hormones, and your child in the womb is just bathing in stress hormones, and so they will come out agitated. So you really want to try and keep yourself, again, just relaxed and not only physically healthy but mentally healthy while you're carrying that child. And again, all the time, because the things that are good for you are pretty much always good for you. So you want to be taking care of your mental health. And then we want to remove additives and dyes from our kids' diets. So many dyes are synthesized from petroleum, which can carry toxic byproducts, including mercury, arsenic, or lead. We found that yellow number 5 and yellow number 6 increase hyperactivity in children, especially those who have ADHD. Also some reds, I think red number 40, I had it written down here somewhere. I lost it. Sorry, guys. But yeah, several of the red dyes as well can cause hyperactivity. And the dyes have been linked to long-term health problems and disease. They have increased hyperactivity, like increased allergic responses. The dyes are just not a good idea, guys. So if you can keep those out. I mean, we see the kid with the blue tongue, right? And it kind of just looks gross. It's because it is. It's so toxic for them. So if we can remove those artificial dyes, you'll probably have better behaved kids. And then eliminate sugar. Sugar and processed foods have been known to worsen the symptoms of ADHD, including inattention, irritability, hyperactivity, and mood swings. It also compromises their immune system, and actually it suppresses it, so we don't have a strong immune response, which is why you often get like a canker sore if you're eating lots of sweet, sugary foods. Anyway, and sugar contains no essential nutrients and can make it more difficult for the body to process out toxins. So your kid's eating candy, right, that's loaded with sugar and loaded with dyes, because kids' candies, just like that lollipop, are super colorful so that it attracts your kids and they want to eat it. So now they can't process out those toxins that they're getting in those dyes and all those chemicals because of the sugar. So it's just like a perfect storm of a child going crazy, right? So we want to avoid these. And then we also, sorry, I thought I had one more in there. And maybe I do, and it's on another slide. But basically, just avoid allergens. So for me personally, I'm not allergic to it, but like I am sensitive to gluten. That's an allergen for me. And when I have that, it affects my mood. And so you'll find, if you really pay attention to the things that you feed your kids and the way that they mentally respond, the way they respond after they eat, you'll find that certain foods are much more pleasant after they eat them, and when they have certain foods, they're much more irritable. You should do this for yourself. If you pay attention, even keep a food journal, you'll know that you respond better after eating certain foods than when you eat others. And so then also we want to eat nutritious foods. We want to have a balanced, healthy diet with nutritious foods can help the body and the mind function optimally. So not only should you be eating the right foods when you're pregnant, but you want to be feeding your kids the right foods. So eat quality protein. Protein's it's a necessary building block, but it also promotes alertness in the brain, while the carbohydrates, right, when we carb load, that makes us tired and fatigued. You don't want to send your kids to school tired and fatigued. So protein and some healthy fat is going to be a better breakfast than the Honey Nut Cheerios, which was my favorite breakfast when I was a kid. Also eat colorful vegetables. That's where you get all of those vital vitamins and just some amazing nutrients. So eat those colorful vegetables. And then also healthy fats. If you spend any time with me, you know I'm a huge proponent of healthy fats. So especially omega-3 fatty acids. They're found in cold water fish oils, also in some seeds. The body doesn't make it on its own, so we have to consume it. And in our American diet, we just are not getting even close to enough. We get too many omega-6s and not enough omega-3s. So you definitely want to make sure you're getting that cold water fish into your child's diet. The omega-3s contribute to several facets of brain function. Our brain is made up of fat, so we've got to bathe it in this healthy fat. This includes sending neurological signals and creating dopamine. The lack of dopamine, which is one of the major causes of ADHD. See, I did have it. And then remove allergens from the diet that interfere with proper brain function. So if you don't know which part of the diet is hard for your kid or is a problem for your kid, try an elimination diet. And certainly call our office. You're one of our patients. We can help talk you through how to do that, or we can also refer you to someone who can help you with that. But an elimination diet is really, really helpful to figure out how you respond to different foods. All right, and then have a helpful environment. The environment that you create around yourself and around your child can really help them to either have success or really fail with this diagnosis of ADHD. So we want to create a positive environment for them. So first of all all kids have challenges, but make sure that your child just doesn't become their diagnosis, that you're just like, oh, it's my ADHD kid, right? I don't think anyone's really doing that to them. But it doesn't mean that they're less intelligent or that they're less valued. It just means that their brain has just a little more trouble processing some things. But so just make sure that they feel loved and they don't feel like they're labeled, right? And then if your child has, ADHD, make sure that their teacher knows that, so that, the teacher probably will because they're in classrooms with tons of kids all the time, so they pick up on this stuff. But just make sure that they're aware of what's going on with your child so that they can create the best environment in the school setting for your kids, because our kids spend so much time in school. Also, create structure in your child's day. And let them help you develop a daily schedule. When there's no structure and no routine in their lives, if they are forgetful and they have trouble focusing and they're hyperactive and want to bounce off the walls, it's going to be very hard for them to get done what you need them to get done, say to get out of the house to go to school in the morning so that you can get to work on time, right? So help them by creating a schedule, and let them help you so that they feel part of the process. Yeah, so it helps your kids stay on track to get things done, but also helps them feel more secure and set in their routine. And then keep organized. Children who stay organized have a better chance of keeping track of homework, tasks, and projects, whether they have ADHD or not. I didn't have ADHD, but keeping track of homework was really, really hard for me. So yeah, help your children stay organized, because not everybody is naturally gifted that way, like myself. Also, with a helpful environment, start their day with a healthy breakfast. So again, I mentioned earlier, a breakfast with some good quality protein and some healthy fats. And if you're not sure what healthy fats are, this is not a nutrition lecture, but you can check out our webinar, Eat. You can come to our Life You Save class. You can check out most of our other webinars where we talk about food, because we talk about these things. And then have your child walk to school if possible. Because if they can burn a little energy on their way to school, that's a great way to get them to then be calm and quiet when they're sitting in class. Make sure your kids have a creative outlet, so whether that be dancing or some sort of like painting or drawing or creating something. Legos, right? Legos are great. But just make sure that they have some sort of creative outlet where they can really express themselves and kind of just let their brains go. Also, set clear rules and boundaries for your children and make sure that you follow through. That's kind of, again, part of that routine. Children do better with stability, so just make sure that they're aware of the rules and the boundaries, and make sure that you keep them that way. So if they have a certain bedtime, really try to get them to bed at that time. That's particularly important for the children with ADHD, or really any sort of like mental disorder like autism or Asperger's or any of those spectrum disorders. You just really want to make sure those kids know the boundaries and that they're consistent. Also, take care of your marriage and your own mental health. You might be like, what does this have to do with me? This is about my kid. But happy couples have happy children. No, that is not a perfect rule, but if there is a lot of chaos going on in your personal life, your kids are going to feel that and they're going to sense that, and they're going to have chaos in their lives. So make sure you focus on yourselves, parents. Make sure that you're taking care of you so that you can take care of your kids. Because again, when you are more mentally healthy, it's easier for your children to be mentally healthy. And then also make sure your child is getting quality sleep. Lack of sleep can heighten the symptoms of ADHD, but also lack of quality sleep. So ways to have your kids get quality sleep is have a bedtime routine. Again, routine super important. Maybe and the bedtime routine I would not suggest is watching TV and playing video games right up until it's 8:30 and then they go to bed. But maybe have some calming activities set up before they go to bed. It's good if we can avoid light from television screens or phones or tablets that emit blue light. We can avoid those lights up to an hour before we go to bed. That'll help your child's brain be more calm and go into a heavier, deeper sleep faster. And then also If your child has a nightlight, if you could do like a red light nightlight rather than, I've seen some blue or like the really bright white ones, because if they have to wake up in the middle of the night to go to the restroom, the light from their nightlight is going to be making them alert. So if you have a red light, that helps their brain stay sleepy. All right. So yeah, those are just some tips to help make sure that they get some quality sleep. All right. And then get adjusted, because I am a chiropractor, so we have to talk about this, right? Parents, you should get adjusted too, right? Chiropractic care is one of the best things you can do to alleviate the symptoms of ADHD. I believe I mentioned at the beginning of this that we have lots of kids in our office that suffer from this disorder, and it is amazing to see what happens to them after an adjustment. So the deal is, when the spine is out of alignment, so you got the bones of the spine, when the bone in the spine moves out of alignment, it creates interference in the nervous system, the signals that are going from the brain to the body, right? So proper brain activity is directly related to proper alignment and function of the postural muscles of the spine. So if the spine is out of alignment, the brain doesn't work as well as it's supposed to. If the brain's not working as well as it's supposed to, you very likely may end up with a disorder called ADHD. And these things often happen at birth, okay, at birth. Look up some videos on YouTube of births. You'll probably be traumatized. But you will see just crazy how kids' heads often get pulled on coming out of the womb. That very frequently causes a subluxation, that's that bone out of alignment that is causing irritation in the nervous system. You can tell I talk about this a lot because I talk fast, right? That bone will very frequently, that very first vertebra, when kids are getting yanked out of the womb, it'll be subluxated. So from birth, these kids have this thing on their nervous system that affects how they are interacting with the world and how their brain talks to their body. Very frequently, they can be uncomfortable. And it's not all about pain, but if they're uncomfortable, certainly they're going to be fidgeting. It's going to be hard to focus. It's going to be hard to pay attention. And they probably can't tell you that they're in pain, because if they've had it since birth, they don't know any different. So get your kids checked, and if they need to, let's get them adjusted. I love that picture. I just love babies. It's one of the best things you can do to alleviate these symptoms. Correcting the root of the problem and removing subluxations can help relieve the symptoms of ADHD long term and promote a good, healthy brain development. I'm telling you what, when I do have children someday, the first thing that's going to happen, or one of the first things that's going to happen, is one of my family members who is a chiropractor will be there, and they will check my child, and if they don't need an adjustment, perfect, excellent. But if there's interference from that very first mental life, they'll get adjusted, because again, I want to make decisions now and in the future so that I can have the healthiest children possible. And I know you want to do the same thing for your children. So yeah, that's one of the biggest things you can do, is get your children adjusted. So, in conclusion, ultimately how you choose to help your child's ADHD is your prerogative. And I know as parents you love your children and you make the best decisions that you can for them. And that is great. However, with natural remedies, there is less risk for side effects and complications. And again, if it is a misdiagnosis, but you do the natural remedies like keeping routine and eating healthy foods and avoiding toxic processed chemicals, you're not going to have bad side effects from that, whether or not your child has ADHD. Yes, so whether an individual has ADHD or not, the tips listed above can help improve health and other overall function in the body and the brain for everyone. See, I keep stealing my own thunder here. So those are just my resources, so you can check out some of those sites if you're curious about more information. This is such a huge and hot topic, so I didn't want to dive in too deeply with you guys, but like I said, when it comes to being healthy, it's pretty much the same decisions rule. Eat well when you're pregnant, eat well before you have a baby, so you can avoid this stuff before your child is born. When your child is born, just make sure that you get an accurate diagnosis. And I would recommend before you dive into the prescription medications, trying some natural remedies. There absolutely are children whose lives are changed and they can be successful because they truly have this disorder and they need it to focus and succeed in school. But I would suggest that children are children, and it's hard to sit still for 6 hours in a classroom. And so let's try some of these natural remedies if we can. And again, let's just do our best to raise healthy children. And I know that you guys as loving parents, that's what you're trying to do. So thank you for joining me today, or this evening, I guess. And I will see you guys on the next webinar. And just make it a great evening. Take care.